Hi, I'm Dr. Jing Pagcatipunan. I'm from the Philippines. I am a pediatric infectious disease specialist, and I'm connected as an associate professor at the University of the Philippines, Manila, Philippine General Hospital. So I have trainings on vaccination, HIV, and TB. So my specialty now is on as a part of the crisis management team of our hospital for COVID-19 pandemic.
You're most welcome. Now, I also understand that you've prepared a presentation for us, giving us a situational overview and some of the unique features of your institution.
Okay. Philippine General Hospital is located at in Metro Manila, the capital of the Philippines, is the largest medical center and the national referral center for health in the Philippines. It's 130 years old. It has 23 buildings around it, and our patient bed capacity pre-COVID was 1,500, 1,100 for service patients, for charity patients, and 400 for private pay patients. We have around 700,000 patients a year with 4,500 employees. And we have 19 clinical departments with around 4,700 trainees. And it operates under the University of the Philippines. So, uh, pre-COVID, our hospital was actually has spillover of patients, not only at the emergency rooms, but also at the outpatient and inside the medical wards. February of 30th of this year, our Department of Health confirms the first case of the novel coronavirus in the Philippines, which was actually identified and started January 18 of 2020. So with that, we prepared our hospital being in the pandemic. So our ward capacity, we have a total of 17 wards with a ward capacity of 50 patients. We brought that down to 20 patients, and all the COVID wards were identified and separate from the non-COVID wards. Our intensive care units are all for COVID patients only. And our outpatient clinic, which is a building outside of the main hospital, was actually closed. And all the elective procedures went on duty at the COVID wards and modified their work schedule, which what we did was they have to go on 7 days straight duty at the COVID ward, and then 7 days off after their duty from the COVID wards. This will actually ensure that they would have enough rest, and also the monitoring for because they are on a high risk area. So monitoring, that is part of the monitoring for exposures or symptoms. The administrative personnels were also distributed over to other vital units like our property and supplies because of the overwhelming uh, requirement for supplies. And then we have been augmented with 98 doctors from our Department of Health. They are volunteer doctors, can be transferred now to PGH once they have been proven to have COVID-19 infection. So we have our command center, uh, which is also we have our transport pods, no, for pediatrics and adult patients because we have so many transfers from the other hospitals. By May of this year also, our medical research laboratory testing facility was issued a license to operate because initially, during the start of the pandemic, only one laboratory was functioning for the PCR test, which was in uh, a, f- in RITM, which is a research institute for tropical medicine. But the problem there is because it's just one lab for the whole Philippines, also have a problem of the transport and accommodation of our healthcare workers because during the lockdown, which started March 16 of 2020, actually until now, we still have community quarantine. One innovation that I would like to share with you also is that we have this telekomusta, which means kumusta means how are you. This is actually a video call na, for the patients and their relatives or families to see them and talk to them while they are in the wards, because most of of our cases, no, especially in the adults, they don't have, they were not allowed to have caregivers because it's a ward, no, of full of COVID patients. Just a few more slides on our success stories. We had three patients who had all all of them had B cell ALL, and they had COVID-19 pneumonia that progressed to ARDS within 1 to 2 days of admission. And we were able to give them all convalescent plasma. And in 2 to 3 days, they improved and actually were sent home.
Excellent. Thank you. So my other question is, have you guys struggled at all with resource limitations? Because looking at this presentation, I'm incredibly impressed by the way that you've been able to reorganize the wards, and it looks like you have plenty of equipment and really wonderful PPE.
Yes, I agree with you that because we're one of the biggest hospital in Manila, we had so many donations of the PPEs. So we have enough supply for several months. And up to now, we have actually adopted the use of the elastomeric mask, okay, so that for COVID areas, so that we can decrease the number of use for the N95. But we still have supplies for the N95.
In one of the sessions, you mentioned that your intensive care unit was only for COVID patients. So the other adults and children that would need admission to the ICU that maybe tested negative for COVID and had an unrelated illness, where did they go for care?
Yeah. For the pediatrics, we retained at least five of bed ICU for non-COVID. But we all know that this is not enough no, for the non-COVID cases. We have other hospitals, other government hospitals around the area. And so we have to, that's why we have the command center, no, to also facilitate transfers of our patients at the ER who are non-COVID and they have to be transferred to the other hospitals because of the ICU or the regular beds. So we do have that command center to assist us.
That was a wonderful presentation, so thorough. Thank you so much.